Good evening, ma'am. My name is Sean Isurano. I'm a student nurse from DMC, and today I'll be your nurse this evening. And, this evening, I'm going to perform vaginal installation to you. So before that, ma'am, may I please know your name, date, and address?
My name is Christine.
Please say your name type for confirmation, ma'am. Okay, Miss De La Peña. So the purpose, this evening, I'm going to perform vaginal installation to you. The purpose for this is to insert some medicine through your vagina. So if you have any, so if you wanna void or defecate, you can do it now. Okay, ma'am. So before that, I'm going to do my hand washing and prepare all the equipment. Is that okay with you, ma'am? Ma'am, I'm done with my hand washing. I have all my equipments that I'll use on vaginal installation. So before I'm going to perform this, do you have any questions for me?
None.
None? Okay, so, okay ma'am, so before that, can you please flex your knees upright? Spread your legs. So, before doing that, so since I don't really have the equipment to perform the actual equipment for vaginal installation, so assuming that this is our applicator and this is the medicine I'm going to get the medicine to install for the vagina. So I'm just going to get the prescribed amount. So assuming that the prescribed amount is 1.5 cc. So after getting that, you need to lock it, and then the medicine too, put it on the side. And before doing that, you have to put on some gloves. So before instilling the medicine to the patient, make sure the patient is comfortable. Ma'am, are you comfortable?
Yes.
Okay, so I'm just going to inspect your vagina for any infection, infection, and odor. Okay. Doing that, so I'm going to do perineal care. So after doing that, you need to change some gloves. So assuming that I've changed the new gloves, now we're going to instill the medication. So using my non-dominant hand, I'm going to open her labia, and then I'm going to insert the medication. Okay, ma'am?
Yes.
Let's hold her a bit. Okay. So after administering the medication, you need we should start to remove the applicator and put it aside or throw it in a kidney basin. And then after that, you need to let the patient remain in this position for 5 to 10 minutes. And as required, you need to clean her perineal with a towel. Dispose of that, and after that, you need to remove your gloves and dispose of it too. So, if the patient is very uncomfortable in this position, we can put a pillow on her butt. Okay, so we need to wait for the medication to have it absorbed around 5 to 10 minutes. So after this, you can ask the patient if she has any concerns. Mom, do you have any concerns, mom? Okay, so after performing this, you need to let the patient know if she has any any concerns, you can ask. She can ask you, and put the patient back in a comfortable position after 5 to 10 minutes of the procedure, and then document all your findings and and do aftercare and ask the patient to thank her for letting you perform vaginal installation. So ma'am, thank you for letting me perform vaginal installation. I'm going to do aftercare and thank you. Good evening, sir. My name is Sean Serrano. I am a student nurse from BNC. And this evening, I'm going to drain the tube here on your wound. So before I do that, may I please know your name, age, and address, sir?
My name is Vaginal 25 from Texas.
Okay, sir. So before I perform wound drainage, I'm going to do my hand washing and prepare all my equipment. Send it to you, sir.
Okay.
And also, the purpose for this, sir, is to collect the blood that's been contained on your the container, so we can put it in the laboratory and identify if there's any infection in your body. Okay, sir. I prepared all my equipment, and now I'm going to perform your wound drainage. So for that, I'm going to put on some gloves. So, assuming that this is our specimen container, we're just going to put this here, and I'm going to open the bags and make sure you don't spill any blood. And then you're just going to pour everything on the bag on the specimen container. And after that, remove the specimen container. And after that, you need to put on some alcohol swabs and rub it on the specimen container on its port. And then after doing that, you need to assume that this is our port, and we need to cover it. So you need to make sure that it's on a flat surface, and then you need to insert it. And before doing that, make sure that there's any leakage or any and make sure there's still room for the patient to move. Okay, sir. Thank you. So next is, if the container is a Jackson Pratt container, what we can do is that, assuming that this is our measuring cup, we need to open the valve at the top, and then make sure to measure a measuring container and pour everything on the measuring container. And after that, put the measuring container on the table, and then assuming it's alcohol swab, you need to clean it on the port, and then disregard the alcohol swab, and then close the port. And just like before, make sure there's still enough room for the patient to move and not feel uncomfortable. So, and before we disregard the specimen that contain, you make sure what's its characteristic, what does it look like, and is it frothy or not. And after performing all that on your wound drainage, make sure that the patient is in a comfortable position, and then do aftercare, and then thank the patient for letting you perform the procedure. So, sir, thank you for letting me perform wound drainage on you. So after that, I'm going to document all my findings, and then do aftercare. Okay, sir?